So, as I said, very warm welcome this afternoon to our Women's Health Seminar for the Kent and Medway Workplace Wellbeing Award. We're joined this afternoon by Nicola Kidney from the Medway Exercise Referral Team, who's going to talk to us about the perimenopause and the menopause. Just a very brief bit of housekeeping before we get underway. Obviously, we're all adults. If for any reason you need to step away from the screen, get a drink, use the facilities, please do so. Feel free to take notes. We will be using the chat function throughout. If you can stay on mute during that the session, please do so. If you, and when we get to the Q&A, we will ask you to unmute. If you want to ask a question, equally type your questions in the chat and Justine will be monitoring that for us. Nicola will be asking us to join in through the chat function throughout, so please do engage and take part. At the end, there will be a feedback survey for you to complete, so please do complete that as well for us. And so I'll stop screen sharing now and hand over to Nicola, who will share some slides, and then we'll get underway.
Hello, everybody. Can you all see my slides? Excellent. Yeah, thank you for that introduction, Michelle. So I'm Nicola. I'm a physical activity specialist as part of the public health team at Medway Council. I have developed a special interest in perimenopause, menopause, life phase, and have done special training have qualifications in this. Personally, because of my own experience of perimenopause going into that life phase, and there's so much information that I feel that we need to empower women to have the knowledge about. So, shall we dive in? So let's just go to the next slide, but also just want to, my next slide, just to make a little bit of a statement. In this course, that I'm going to be referring to women. This is also for those that were born and assigned female at birth. So although I refer to women, it's also going to apply to those who are assigned female at birth. So the discussion topics today, we want to think about women's health in the workplace, perimenopause to menopause, heart health, bone health, brain health, and coping strategies and lifestyle changes. So there's a lot to get in, and each one of these topics could have its own presentation. So one of the reasons why we're doing this is thinking about women in the workplace. So if you're looking at these stats, I think 73% of women aged 16 to 64 in the workplace. 1 in 3 female workers are likely to be over the age of 50 by 2030. And I think with the pension age gradually starting to increase, we're going to see a lot more of that. 30% of women took sick leave to manage their menopausal symptoms. And a third felt embarrassed when raising this awareness with their managers about the menopause, particularly if they've got male managers. And 2/3 of the women have difficulty concentrating due to menopausal symptoms. And that's one of my ones, I'll tell you that now. So if I go off track slightly. So knowledge is power. So we want to empower women so they can make the menopause transition as seamless as possible for them. Now, I always love a little bit of a quiz. So this is where I would love it for you to use the chat box and get a little bit of interactive. So Justine is going to monitor the chat for me. And just want to think, do you know the answers to any of these? What do you know already? So first question, do you know what is the average age a woman can expect to go through the menopause transition in the UK? What do you think in that? I can see all the numbers coming in, wide ranging. The average age in the UK is 51. That's average. There can be a window for that, but the average age in the UK is 51. Some Asian countries, it can actually be around the age of 55, but in the UK, it's 51. So the next question, when can it be considered that you are post-menopause, that you've gone through the menopause transition? What do we think on that one? Yep. 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 Yeah, you need to be, for you to be considered post-menopause, or you need to be 12 months and 1 day for you to be considered to have gone through the menopause. Now, that is a medical line. Again, there can be a little variety in that, but the general guidance would be, is if you've gone 12 months, 1 day, without a period, you're postmenopausal. Any bleeding after that date needs to be investigated. If you went 11 months and then had a bleed, then you need to start your 12 months again. So can women get pregnant during this menopause transition? Yes. Yeah.
I think that's resounding.
Exactly. It's like, yes, yes, yes. Exactly. Yeah. I think when women start to go through and periods start to come irregular, they think they don't actually need to use contraception, but they do. So true or false? 1 in 5 women will develop osteoporosis in the UK. True or false? Yeah.
I think that's mostly true, isn't it? I think that what everybody's saying. There's so many answers.
I know. I love the interaction. Would it shock you to say that is false? It's actually 1 in 2. So 1 in 2 women are at risk of the osteoporosis. Not 1 in 5. It's 1 in 5 for men, 1 in 2 for women. Now, next question. There are 3 mammals that go through the menopause, one of them being humans. Any guesses to what the other mammals are? Dogs. I like it. I just thought this question would just make it a little bit fun. Panda, chimpanzee, yeah.
There's a huge range there.
I know.
A lot of elephants,
I know,
actually.
exactly. Also, you never know when this may come up in a pub quiz. Well, I think it should, because then they're raising awareness of menopause. It's actually killer whales and pilot whales. They're the other 2 mammals that go through menopause as well as humans. I think people always think it's like chimpanzees and monkeys, but whales.
I think somebody did say whales, so well done.
Yeah, well done on that one. So the next 2 questions are going to kind of like blend in, and they're going to cover them on the next couple of slides. So what is the menopause and what is the perimenopause? Do we actually know what it is? Because this is where I'm going to go to my next slide, because I'm going to answer those 2. So I hope that's got you thinking a little bit. The next slide. So what is the menopause? It's a point of transition from a woman's reproductive years to a non-reproductive life phase. Like we had in a little quiz, 12-month period 3, your class is postmenopausal. Once again, that's a medical line. It can be a little variation into that, but that's a medical line. The average age that we had in the quiz, 51 in the UK. And it affects women very differently. Some women will absolutely sail through the menopause. Other women can have a horrendous time, which is why we want to try and raise awareness. So what is the perimenopause? So the perimenopause is that transition leading up to menopause. It can really vary from, once again, women to women. It can start in 30s for some women. It can last 2 to 10 years. women's symptoms can last that long. It can be a mirror image of puberty. So thinking how your puberty was, that could give you an idea as to what's going to happen when you go through the menopause transition. Our ovulation cycles become irregular. The production of hormones and ovarian function slows down, and so women are still fertile at this time. So it's a perimenopause that could be a whole array of symptoms, and say 2 to 10 years. I'm a great believer and I love having motivational quotes, and I really love this one. It's not the strongest of the species that survive, nor the most intelligent, but the ones that are most responsive to change. I really like that one. So I think going through the menopause transition, we need to start embracing the change. So what can happen when hormones fluctuate? So many things. So they say there can be, I've seen different researches, numbers of this, anywhere between 34 and 45 symptoms for perimenopause life phase. I've just put some on here. So the one most people think of is the hot flushes and night sweats. Weight gain, inability to lose weight, insomnia, anxiety, fatigue, irregular periods, itchy skin, mood swings, increased pain, constipation. I'm a big fan of talking about constipation, and we need to make this more of a subject and awareness. So that's why I've stuck the picture there. Loss of confidence, brain fog, vaginal dryness, incontinence, bloating, headaches, joint pain. There are lots of other signs and symptoms as well, but also what we want to think of is, are they perimenopausal, or is it because there's something else that's going on? But so there are many, many more. You may also think someone there that you could add to that list as well, but that's just some. So a very brief view of hormones. So this is very brief. So the word hormone comes from the Greek word meaning messenger. Our hormones affect absolutely everything in our body. And I think if you think about hormones working together like an orchestra playing together, and they're playing an amazing piece of music. If they're all playing together, everything's synchronized and harmonized. If you think about if the conductor comes away from that, and then the orchestra is going to go all over the place, it's not going to be in harmony. So think about hormones, they need to be in balance with each other. And that's what happens when we go into the perimenopause, is we could still not be menopausal, but the hormones start to fluctuate. And that's be the perimenopause. So a very brief view of estrogen. So estrogen is a name of group of hormones that are produced in the ovaries until menopause. The ones we tend to think about mostly of is in that group, mainly is 4, but is the estradiol and estrone, but say there are others as well. Estrogen is cardioprotective and it helps maintain heart health, promotes bone health, supports the collagen in your skin, helps memory, production of serotonin, and it can have like over 300 functions in our body. Thinking about the list of symptoms, estrogen can have an effect on all of those. I always like to think about estrogen. You may wonder why I've got a picture of grass there. So estrogen is the hormone of growth. So it helps promote and grow, so grows the lining of the womb. So estrogen, hormone of growth. Progesterone, another important hormone. It helps regulate our cycle, and it's generally known as a pregnancy hormone. Ensures there isn't excess estrogen in the body, once again, the excess growth. It can help promote sleep, promotes the feelings of calmness and anti-anxiety, helps moderate pain tolerance, and it tends to be the first hormone to decline. So a lot of women, when they do go into the perimenopause, menopause, can actually be in estrogen dominance. So once again, the balance of the hormones, progesterone could be dropping quicker, so actually estrogen is higher. And it can affect about 30% of women when they go into the menopause, that they're not actually, the estrogen is declining, but the other hormones are declining quicker. So if you think about progesterone, is almost like the lawnmower, which is why as a lady, the lawnmower, is keeping the estrogen in check, mowing that grass. And testosterone. It's not just a male hormone. Testosterone, we can have actually about 3 to 4 times the amount of testosterone for women as estrogen. So we do need testosterone being females. It helps maintain energy levels and mood, supports bone density, supports cognitive function, and supports muscle health. So again, there are other hormones at play, but they're the 3 kind of like main ones we're thinking about at the moment. So thinking about hormones fluctuating, and one of the main symptoms that women complain of is hot flushes. As again, it doesn't happen to every woman. Some women, they can have a severe hot flushes. Other women, they can just feel, well, I just feel a little bit warm. So it really does affect women differently, but it's generally when the estrogen levels start to fluctuate throughout the day, and they can fluctuate hourly throughout the day. So what actually happens when you have a hot flush is it disrupts the hypothalamus at the base of the brain, which regulates body temperature. And it's approximately 75% of women will experience a hot flush as part of their menopausal symptoms, but say it can vary to really severe to just feeling a little bit warm. There'll be a few more slides on a hot flush because it is something that we can help with. Also, it's not always the estrogen that's declining that could cause a hot flush. It can also be linked to a thyroid dysfunction as well. So sometimes not always estrogen, it could be thyroid that's causing hot flushes. But what can trigger a hot flush? Caffeine, smoking, the changes in the external temperature, alcohol, spicy foods, sugar consumption, and stress. So what happens, once again, as we go through perimenopause, menopause, is our core body temperature, because of the estrogen declining, our core body temperature range becomes narrower. So our body's ability to regulate the temperature changes. That's why sweating can be more easily triggered, just because our core body temperature just narrows down. A US study of women who had the most hot flushes, this was a big study, and it was women who were stressed, were obese, and smoked. That's who had the most hot flushes. And smoking, I just found this some research out yesterday, so I'm going to add this in, is smoking 10 or more cigarettes a day can increase by about 40% of you having more hot flushes through smoking just 10 or more a day. It can also put you possibly into an early menopause by about 5 years. So at the end of this, I will send you a hot flush diary. And if you do have hot flushes, it's a really good tool to just write down when you have the hot flushes and what have you done. Were you stressed? Did you eat something sweet or sugary? Did you have alcohol? Did you have caffeine? So we can send you that at the end, a hot flush diary, because it's good to work out what your triggers are. So what can help manage a hot flush? So first thing is avoid the triggers. Like I said, about keeping a hot flush diary. Eat plenty of fresh fruit and vegetables and healthy fats. keep well hydrated, and there's some good research about paced breathing. So paced breathing is just taking a slow focused breath in for 4 counts and then exhale 4 counts. So if you start to feel like there's a hot flush coming on, people tend to get a little bit panicky about it, which then can make the hot flush worse. Whereas if you can think, okay, I'm just going to think about taking a focused breath in, 4 counts, exhale for 4 counts. Just to calm the body down. It's not necessarily going to stop the hot flush, but it can reduce the severity of the hot flush. So being more physically active. So again, people worry about, oh, I'm going to get hot and sweaty, so I'm going to have a bigger hot flush. Being more physically active and looking after the body can once again reduce the severity. It's not going to stop the hot flushes, but just generally being healthy, we can reduce the severity of the hot flushes. Also, to wear as much as you can natural fibres. So things like cotton, linen. So that was the hot flush. So what are the important factors we need to be addressing in this life phase? We need to be addressing heart health, bone health, brain health, and pelvic health, because all of these are affected by estrogen. And if our estrogen is declining, we need to make sure we're looking after and improving our lifestyle to help with heart health, bone health, brain health, and pelvic health. There's lots of things we can do. So the first one is talking about heart health. So why is it important for women to know about heart health? Heart disease is the #1 killer of women worldwide post-menopause. It's twice as many as breast cancer. I think people always think breast cancer is the #1 killer worldwide, but it's actually heart disease. Before menopause, women will have lower rates of heart disease due to the protective effects of estrogen. As our estrogen starts to decline and post-menopausal, we have the same risks as men for heart disease. Heart disease and heart attacks in women often get misdiagnosed because the signs and symptoms are not always the same. They can be different. So we need to raise awareness. And this is from the British Heart Foundation. And I think these stats, once again, are quite shocking. So 28,000 women in the UK die from heart attacks each year, 77 average per day, or 3 every hour. So you can find those stats on the British Heart Foundation website, which I put on my resource list at the end. So what are the signs and symptoms of heart attack in women? People always think, once again, chest pain. Yes, chest pain, the discomfort that doesn't go away, pressure of tightness and squeezing, the pain in the left arm or right arm, neck, jaw, stomach. The ones that people don't always think about, particularly in women, is just the feeling nauseous, lightheaded, dizzy, shortness of breath, feeling of anxiety similar to a panic attack, and excessive coughing or wheezing. Lots of women probably have those last 4 and they just put it down to something else. So if you're having those symptoms and they don't go away, you need to get it checked out. So the risk factors for women and heart disease. Now, some of these we can't change. Lots on here we can change and be proactive in our own health. So obviously, as we start to age, our risk factors are going to go up. The decreasing hormones, particularly estrogen. So estrogen is cardioprotective. It also keeps our blood vessels nice and mobile and elastic. High blood pressure, high cholesterol, diabetes, smoking, not doing enough physical activity and sedentary lifestyle, and obesity. So we can't change the fact that we're getting older, but we can definitely start to help. High blood pressure, high cholesterol, diabetes, smoking, all those other things, we can make positive changes. So what can we do? We set the stage with some stuff that's a little bit negative, but there is so much we can do. So the first thing is know your numbers. So do you know, again, you can put this in the chat, do you actually know what your blood pressure reading is? Do you actually know it? This stats, once again, this may change in the next few months, but these are the recent stats from the NHS website. So a blood pressure reading between 90/60 and between 120/80 is classed as normal blood pressure. A high blood pressure is 140/90. They are almost like looking to change these stats pretty soon. But a blood pressure reading of between 120/80 and 140/90, so if it's in between those two, you are at risk of developing high blood pressure. So this is your chance to start to think about making lifestyle changes to reduce the blood pressure down. Do you know your resting pulse? So I just want to ask in this, do you know what your resting pulse rate is? You can put it in the chat, whether you know what your resting pulse, or no, do you know how to take your pulse? Because we're going to do it now.
It's quite a few no's.
Exactly, which is why we're going to do it now, because this is so important that we know how to check our own pulse. So I'm going to teach you how to do that now. So I'm just going to ask my colleague, Mark, do you have a stopwatch? Yeah. So what I'm going to ask you to do is I want you to think about, let's get this screen so I can see. That's it. So you want to take, you don't want to use your thumb because your thumb has a pulse in it. So if you think about taking the two fingers and place it at the base of your thumb, and you just want to think about just pressing down. And as you press down, you should start to feel a heart rate. Can you all kind of like feel that you can get something there? We're going to take your heart rate for 30 seconds. And I want you to count what numbers you get in 30 seconds. Sometimes if you can't feel anything, you have to almost like just move around a little bit and then just press down a little bit more. Yeah, so it's almost like thinking going from the thumb, two fingers, and just press down. If you can't find one, maybe just try it on the other hand and see if you can find it on that hand. Sometimes you're able to pick it up easily on one side and not the other. But if you don't feel you can get it today, so again, we'll make sure you get this in the chat so we teach you how to do it. So I know for me, I can get it on one side better than I can the other. So maybe just try that. So once you've found your pulse, it says 60 seconds on there, but we're just going to do it for 30 seconds because then we'll times it by 2. So when you're ready, we're going to start counting our pulse now. Stop. Did you kind of like get a number? Then if you times that by 2, that would give you your pulse rate at the moment. So it's not, so that's it. Yeah, if you've got a number, put it in the chat. If you've got a number, it's not your true resting pulse because your resting pulse would be done first thing in the morning when you've had no caffeine, you're nice and chilled and relaxed. But the average resting pulse can be anywhere between 60 and 100. But what we want to notice from that is, was your pulse regular? Did it have a nice regular beat to it? If not, is something you need to just keep checking over the next few days. If it still continues to be a little bit irregular, you need to just go and get it checked out by your GP, because it's one thing that gets undiagnosed quite a lot is arrhythmias. And as women do once again enter the menopause, we can be more increased risk of these types of things. Yeah, so anywhere between 60 and 100, but is what is average for you. So an athlete may have a resting pulse of 40. But if you don't do any exercise, you have a poor lifestyle, having a resting pulse of 40 may not be great and may need to be investigated. So again, when you do some exercise, your pulse could be up to about 120, 130, because you've done some exercise. If you're at rest and you have a heart rate of 120 and 130, you've not done anything, you need to go and get it checked out. And next thing is, do you know your waist measurement? So a waist measurement for women, generally of above 35 inches, actually a little bit less than that, but generally 35 inches and above, you are at increased risk of heart disease, diabetes, cancers, and dementia. So the first thing you need to know is, do you know your numbers? Because then you've got a starting point where you know you can build on and improve. But there are other things we can do. So I hope that was helpful. So we want to think about eating more fruit and vegetables and increase fiber. So increasing fiber, we tend to not have enough fiber in our diets. So thinking about, generally the guidance is about 30 grams of fiber a day. Slice of wholemeal bread is about 3 grams. An apple with the skin on is about 3 grams. And when you think about that, are we actually getting enough fiber in our diet? Majority of people this day and age, it's no. Reducing saturated fats, increasing physical activity, avoiding the sedentary lifestyle. We want to moderate alcohol use. Once again, the research on that is, some people say having your glass of red wine is fine. Some people say no alcohol at all. Just think, what alcohol are you drinking? How much of it are you drinking? Can you moderate it? Reduce stress. And obviously reducing overweight and obesity, because that's going to increase the risk of heart disease. And you'll probably start to see as we go through this, the same message is being said. It's again another one of my motivational slides. We don't want to regret growing older. It's a privilege that's denied to many. So bone health. So as I said in the quiz earlier on, it's actually 1 in 2 women at some point will develop osteoporosis in the UK. And 50% of all postmenopausal women will have a fracture related to osteoporosis. Once again, postmenopause, we lose bone density and bone mass at a rapid rate. It can generally start to deteriorate by the age of 30, depending on, once again, lifestyles, risk factors. Some it can be a little bit earlier. And the signs are not always obvious. Generally, it can be a loss of height, pain in kind of like the major fracture point, so upper back, pelvis, spine, that just won't go away. And a lot of the times it can be the first sign can actually be a fracture. Now, with regarding to thinking about bone health, from the World Health Organization, they are almost putting messages out now that we are sitting on an absolute epidemic of bone health issues. That because people aren't doing the physical activity, they're having a more sedentary lifestyle at a younger age, they're not building up their bone bank. So we build our bone bank up in our late teens, early 20s. So if we're more physically active in that life phase then, and getting the good calcium in, we're going to have a better bone bank for when we do start to lose bone mass, bone density as we go into the menopause life phase. But because we're not doing that, people are becoming more sedentary. They're actually getting really concerned that this could be the next epidemic. Is people are going to start fracturing younger. But there's so much we can do to help our bone health. So the risk factors, being postmenopausal, the estrogen reduction. Again, can we change that? Premature menopause, estrogen reduction again, can't always change that. People have had an early hysterectomy, that can be a risk factor. But the things we can start to change are smoking, if we have a sedentary lifestyle, if we have a heavy alcohol consumption or a heavy caffeine consumption. Now you may be thinking, what is a heavy caffeine consumption? Actually stating is like 400 milligrams a day, which is 4 cups of brewed coffee. So think, how much caffeine are you having in a day? Tea has caffeine in it, but it's not as linked as coffee because of the antioxidants that you get in your tea. They think that actually counterbalances the caffeine. So it's more linked to coffee. Also on there, I'd add in fizzy drinks, but that's going to be on the next slide. So also think, how much coffee and caffeine do you have in a day? So what can we do? So again, there's so much we can do. So eat more calcium for a variety of sources. I think always people think about calcium as from dairy products, but also we have calcium, nuts, broccoli, oranges. So getting a wide variety of fruit and veg. We need to get outdoors as much as we can. So we're getting our vitamin D from the sun because it absorbs in our body better than it being added to food, but you want that safe sun exposure. So again, avoiding the sedentary lifestyle, because if we're not moving, we're not getting the tendons and muscles to pull on our bone to stimulate bone growth. Want to be resistance training, it doesn't have to be in the gym, it could be body weight, just getting out of the chair a few times, doing a few sit to stands. So again, avoid excessive caffeine, avoid excessive fizzy drinks. Now it's specifically linked to soric acid that are in the fizzy drinks. So it's mainly looking at the Pepsis and the colas. There's not a big link with fizzy water. It tends to be the fizzy drinks that have caffeine in it and have soric acid. Another one of my slides. I choose to make the rest of my life the best of my life. So you may start to see a same message coming on from the heart health and the bone health. Brain health. Another important thing we need to be thinking about for women in this life phase. So if you look at some of those statistics on there, it tends to affect women more than men. Potentially, they're still doing lots of research in this, potentially due to the reduction of estrogen, because we have estrogen receptors in our brain. The World Health Organization estimates that the global number of deaths due to dementia will increase by 40% from 2015 to 2030. So I don't think we're always necessarily thinking about brain health as much as what we should. There's, so again, some research I was reading a few weeks ago that they actually think about 85% of the dementias can actually be lifestyle attributed. So what are the risk factors for cognitive decline? Type 2 diabetes, poor cardiovascular health. So once again, the declining estrogen due to, once again, the estrogen receptors in our brain. Poor oral health. There's a link to periodontitis and cognitive health. Smoking, excess alcohol, obesity, sleep deprivation, and sedentary lifestyle. So if we're not doing exercise and being physically active, we're not getting that blood flow to the brain. So poor cardiovascular health is going to increase the risk of vascular dementia. There's also, this may come up on the next slide, but I'll talk about it now. There was a study of, it was 300 sets of female twins, and the stronger leg strengths the women had, the reduced risk of them having an aging brain. So the stronger their legs are, they had a healthier brain as they aged. So then they reduced the risk of the dementias and Alzheimer's. So need to keep our legs strong. They don't know the actual reasons why from that study. They just had a link. So I think they're going to be doing much more research into that. So what can you do? We want to control the controllables. So the factors that can improve and increase our cognitive health. So movement and exercise, once again, like I said, that direct link between leg strength and cognitive health as we age. Getting good nutrition, the healthy fats, the omega-3s through your fish, your nuts, wide range of fruit and vegetables, less sugar. Staying hydrated, I think this is a big one at the moment, is I think most people don't drink enough water. 75% of the brain is water, and a 2% loss of water can cause neurological confusion, brain fog, tiredness, fuzzy, word finding difficulties. And on that note, if you've got water with you, I'm going to get you to take a sip of water now, because I am. And you want to think about sipping water consistently throughout the day, because I think lots of women almost like get scared to drink too much water because they're scared they're just going to end up in the bathroom all the time. But if you sip water consistently throughout the day, the body's going to absorb it much more. So if you're starting to feel like brain fog, tired, fuzzy, are you dehydrated? There may not necessarily be menopausal symptoms, you could just be dehydrated. So sip water consistently throughout the day. Ensure you have good oral hygiene, the dental health checkups, good sleep hygiene. So the sleep and sleep hygiene can be a whole presentation on itself. I think we tend to have too much screen time with phones and laptops just before we go to bed that can disrupt sleep. And just generally being in nature. So being around trees, grass, seeing green can really help cognitive health. So again, those subjects on there could be a whole presentation on its own. So factors that we can help improve our cognitive health. So we can think about doing some motor challenges. So think when you clean your teeth, could you balance on one leg and clean your teeth, or maybe close your eyes? That's going to do multiple things. It's going to challenge your cognitive health, motor challenges, but it's also going to help improve your balance just by practicing standing on one leg, but do it while you're cleaning your teeth, multitasking. Could you practice writing with your non-dominant hand? Have a go at that, see what happens. Dancing and listening to music. Change your furniture around. So once again, you're challenging your brain. Just move the furniture around so you have to walk a different way into the room. Bit extreme that one, but it can work. Learn a new language and get a new hobby. So what can you do that's something different where you're challenging those motor challenges in your brain still? So aging is not a lost youth, but a new stage of opportunity and strength. So strategies to restore balance. So to help all those things, so heart health, brain health, your bone health. So yes, we're in perimenopause and our estrogen is declining. So we're going to have the effects, but there's so much we can do to help ourselves. So we want to stop fatty diets. We want to make sure we're getting all the nutrients in that our body needs. Reducing high sugar and refined carbs, so like your cakes, biscuits, sweets. Are you getting enough protein and good fats in your diet? Reducing alcohol, reducing your sedentary behavior. That's a whole risk factor on its own now, equivalent to smoking, sedentary behavior. Just generally being more physically active and think healthy lifestyle. Are you doing the basics? So that's what I think is biggest take home with this is, are you doing the basics? Are you being physically active? Are you getting your 5 portions of fruit and veg in a day? Are you not being sedentary? Are you getting up and moving down and walking away from your desk? Are you doing the basics? Could you start to cook from scratch more? Again, stand and move, morning sit. Do activities that bring you joy. Sleep, thinking about your sleep hygiene. Once again, that's a whole subjects on its own, and we could do a separate presentation on sleep hygiene, but reducing the screen time, making sure you're sleeping in a room that's dark and cool, getting out and enjoying nature, and cut down on toxic people, as well as alcohol and sugar. Get rid of the toxic people. Physical activity strategies that can help in this life phase. So, strength training. Don't think it has to be in the gym. It could just be getting out of a chair a few times. It could be done with resistance bands. It could be done with body weight. Muscle is metabolically active. As we do age, we do start to lose muscle mass. So we actually reduce our body's ability to burn calories at rest. So the more strength we have, particularly once again in our legs, going back to what I said earlier, as well as thinking about improving balance, your ability to maintain your independence, you can improve brain health. Aerobic exercise for heart health. Want to make sure see, this is where my brain goes. Physical activity for bone health. You want to make sure we're getting some impact, but it's safe impact. So some women can still find they can go out and run and do some impact, but you want to make sure it's pelvic floor safe. So doing jumping jacks could be good for bone health, but not necessarily pelvic floor safe. If you're having issues with pelvic floor health, then doing jumping jacks not be the best idea. But what you could do is just do gentle little heel raises. So just lifting the heels up and taking them back down. Lifting up, heels back down. So you're getting a little bit of impact into the body. So it's then helping bone health, but it's also pelvic floor health. Do exercise that brings you joy. Don't exercise for punishment, because then you won't enjoy it, you won't stick to it. You want to be bringing joy into your life. As much as you can, get out and enjoy nature. So exercising, walking outside, amazing. You don't have to go into a gym and walk on a treadmill to do it. Get outside. But also taking time to think, are you bringing calm into your life as well? As well as doing all the physical activity, you need to make sure you're giving the body a chance to rest and recover. Meditation. There's some great meditation apps out there. So you want to think about being physically active, but heart health, brain health, bone health, and our mental health. So again, that could be a whole presentation on its own as exactly the types of exercise we can do. That's just a brief overview. Now I put this slide in, hormone replacement therapy, because normally it comes up in the questions and it's something you get asked a lot about. I'm not a GP or a doctor or practice nurse, so I can't comment on hormone replacement therapy. All I would say is it's a personal choice that you need to have a conversation with your healthcare professional. It's a personal journey for every woman. Thinking about, can you make lifestyle changes to improve your health? Or do you need to be having a talk to the GP or healthcare professional? It's so individual for each woman. It's not a one size fits all. So what to do next? So if you're really struggling and you've made lifestyle changes, that's when you may want to go and make an appointment with your GP surgery. But ask who is the specialist in that surgery and menopause, because a lot of the time it's the practice nurse. It's not the actual GP, it's a practice nurse. You want to focus on one thing at a time. So thinking about what change could you make today to improve your health and well-being as you go through this transitional life phase. Could it just be having a water bottle near you that you could just start to sip water consistently throughout the day? Could you just go for a little walk at your lunch break? So just think, what could you do today? So that was a brief whistle-stop tour of menopause and the factors we need to be concerned about in that life phase and how we can help improve them. But there's so much more information on these sites. So womenshealthconcern.org is the patient-facing arm of the British Menopause Society. There is so much information on there about nutrition, hormone replacement therapy. If you're struggling to get an appointment with your GP and discuss about it, obviously you have to pay for it through it, but you've got specialist nurses on there that you can have a chat to. The menopausedoctor.co.uk, once again, that is pretty heavy promoting HRT, but there are so many resources on there. There's fact sheets and booklets on nutrition, on bone health, on heart health, everything you can think about menopause, and they're all free. So it's a great resource to go and look at. Menopause Matters, another great resource. The British Heart Foundation for educating about heart health, particularly in women. The Royal Osteoporosis Society, loads of information on there and how we can help our bone health. And this is a really good site, the Menopause Expert Training. You can go and do a little free course. So much information on there. They'll go into so much more in depth about particular nutrients we need to be taking. Virtually every aspect about menopause you could think of is on there. I would highly recommend you go and check that one out. Loads of information on there. We just scratched the surface of a little bit today. Going to have so much more information on there. Pelvic floor, the NHS pelvic floor squeezy app. That's a really great resource to help educate you about pelvic floor health. I can send you a hot flush diary, so you can just make little notes. Are you having triggers to your hot flushes? Is it after you've had a cup of coffee that you have a hot flush? And a menopause symptoms tracker I can send you as well. So that can be really useful if you are struggling with symptoms when you go for your GP. What are you really struggling with? Because sometimes when you're in that appointment and you've got like 5 minutes and you've got to get everything out. So it's just a little sheet where you can tick the ones you're really struggling with, and it's all there for the GP or practice nurse to have a look at. So you'll get a copy of these slides. That's why they're quite wordy, because you're going to have a copy of them. And the time to repair the roof is when the sun is shining. So you want to think about what lifestyle changes can we make now to help our menopause transition be as great as it can be. And thank you for listening. So, do we have any questions? So that was a lot of information to get in, and we was literally just scratching the surface of this subject. So each one of those things we could do a whole presentation on its own. And I would love to know if there's any particular subjects that you need to want to know more of.
There was a few questions. There was two good questions, one from Nalita and one from Hayley. Nalita said she would like to know how long she should do the paced breathing for. And Hayley said, is there any strategies for employers to promote their women, especially in the office where we are mostly sedentary?
Yeah, I'm going to hand that one over to Michelle, because I think Michelle's going to follow up with a little bit of a slide on the workplace health, what employers can do. But with the paced breathing, when you do your paced breathing, you want to think, how long do you need to do the paced breathing till you feel the hot flush subsiding? So it can be you do 5 paced breathing for 4, count of 4, breath in, exhale. Some women it may be a couple of breaths. It really is dependent on what situation you're in, how bad the hot flush is. So it's just when you feel a hot flush coming on, just think, okay, paced breathing. I would say I always like to go for average about 5 to 10, and you should notice it then starts to calm down. So it can be really beneficial for a lot of women. So it won't necessarily stop it, but it can reduce the severity of it.
I have another couple of questions. I don't know if you've got time.
Yeah.
There's 2. Tony has said, for women that don't have periods and have been on a pill for contraception, when is a good indicator that the menopause has started? And Karen just wanted to know a bit more about food that could help.
Yeah. So with the first one, if you're on contraception, you're not really going to know. That's the thing, you're not necessarily going to know. So that would just be having regular checks with your healthcare professional, be it the practice nurse, and just thinking, are you having symptoms? Do you have like brain fog? Do you have hot flushes? So if you are on contraception, it is going to be difficult to tell. And that's the conversation, that one is to, have a conversation with your GP or healthcare professional. What was the other question?
I've got 3 more questions.
Okay,
now. So one about food that could help.
The food. Can I just, the food. So again, I'm not a nutritionist, so I can't go into the ins and outs of what food. I can just give a wide advice. So are you getting enough fiber, the 30 grams? Are you getting your fruit and veg in, the minimum amount? Most people aren't. But on the menopause expert training, they go into the foods in a lot of detail as to what nutrients you need to make sure you're getting in your diet and the food sources they come from. There's a lot of information on the menopause expert training about nutrition and specific foods. So that's where I'd signpost for that one. So I'm staying within my scope of practice.
There's a question from Karen who says about blood tests, do they help to identify? But I also have a question for women who may be on drugs such as tamoxifen that can stop estrogen and progesterone production.
Yeah, so blood tests are, so what tends to happen at the moment with GPs is they tend to go on symptoms. So if you are around the age of late 40s, early 50s, they won't do a blood test. They'll just go on your symptoms, and that's what they're prescribed from your symptoms. If you are under the age of 45, the GP may start to do a blood test if you've got the signs and symptoms of what they think is you're having menopausal symptoms. They don't tend to do blood tests if you're at that age bracket because the hormones tend to fluctuate so much. But if you go to private practice, they will do a blood test. So it really does depend. So they don't tend to do it on the NHS because they will say the hormones fluctuate to, one day you could have a high estrogen, the next day your progesterone could be higher. It fluctuates so much. So they tend to diagnose on symptoms, but private practice will tend to do a blood test. I can see benefits in both. And the other one was?
Tamoxifen, sort of blocking estrogen and progesterone production, I believe.
Yeah. So once again, when you're talking about tamoxifen, it's then looking at lifestyle changes. So again, I may be stepping out of my scope of practice, but they wouldn't necessarily prescribe anything if you're on tamoxifen and the reason you're on it is because any particular cancers were estrogen driven. So that's when you need to look at making sure you have good lifestyle changes. Private practice, they can prescribe at much lower levels. So some women can go to private practice and be prescribed. But once again, that's a conversation for you to have with your healthcare professional. But making lifestyle changes to help improve the symptoms. So if you're on tamoxifen, making sure you are doing your exercise to help bone health, heart health, brain health. See, some of these, you can just go down a rabbit hole with all of these.
I don't think we have any more questions, Nicola.
Okay.
I can see. So I don't know if Michelle
Yeah, Nicola, if you could stop screen sharing, thank you for that. It was so interesting. I love all the motivational quotes as well. I've jotted some of them down. So
I know, I like motivational quotes.
Yeah, really good. And I'm definitely going to make sure I'm doing more walking and cycling, getting my legs as strong as possible. So I'm very conscious of the time, so I appreciate that it was to run till 2. So if anyone does need to go, then please feel free to dip out. If you need to get on with other things, that's absolutely fine. I'm just going to try and share one slide about some top tips for organisations, which might help answer Hayley's question. Bear with me 1 second. So these top tips for organisations are really in addressing just general health and wellbeing. Obviously, any of these things would support menopausal health as well. So I think it's really key for organisations to have open communication. If that's part of what you do, then women will feel more empowered to come forward and seek help and to get that information from the employer. Making sure that you include health and wellbeing provision from when someone starts with the organisation and throughout the year. If you do have an employee assistance provider in place, such as a staff counselling line, or perhaps promote the Kent and Medway Release to Pressure helpline. So if women are going through these changes and are feeling higher anxiety levels or stress and depression, it gives them that opportunity to seek some help and get those managed. We'd also really encourage workplaces to carry out their return to work interviews and make those reasonable adjustments if people are taking time off sick. As Nicola said, sort of a third of women, 30%, take time off to manage their symptoms, and because it's making them feel unwell. So having that return to work interview and finding out why that person was off, and if there's something you can do to support them, perhaps making a reasonable adjustment to their working hours, if they can work more flexibly. And as the next point says, having those policies in place, such as robust absence management, hybrid working, and the menopause policy, just so that staff are aware of the support, and it can be backed up with policies to manage time off, allow flexible working, and make the best of this sort of life situation, really. And really encourage workplaces to have staff wellbeing champions in place, obviously not just for menopause health, but staff wellbeing champions across your organisation who can help to run initiatives and take part in things like cancer awareness campaigns, healthy eating months and things like that. And then have a look at your workplace environment as well. We've heard a bit about sedentary behaviour today and how that's not good for us. Can you change your workplace environment to encourage people to get up and move around more? Mark's in the meeting, he's done a lot of work on active offices, but having things like a sit to stand desk platform so that people can stand up and work while they're on phone calls, or do a bit of work standing and then sit down at other times. Even simple measures, don't have your waste paper basket under the desk, put those waste paper bins and recycling down the other end of the office to encourage people to get up and move around. Let's have a communal kitchen. Encourage things like walk-in meetings. There's no reason that you have to go and sit in a meeting room. Why not go out for a walk-in meeting, stretch those legs and build up that leg strength while you're having a catch-up on a one-to-one basis. Support things, as I said, like such as health campaign events, and just that general promotion of healthy lifestyles. The more we can do to encourage our colleagues and ourselves to eat more healthily, exercise more, improve our brain health, I think that overall helps us to manage these life transition stages. And the final point is to offer training for managers. So not just training necessarily in menopause health, although that would be fantastic if you can do that, but just in general in promoting healthy lifestyles, in managing mental wellbeing. And these are all things that the Kent and Medway Healthy Workplaces programme is there to help you with. So if you have got questions or you've got some particular issues you want to talk to us about, we're more than happy to have a separate conversation with you. Normally at this point in our seminars, I'd run through a brief overview of what the programme does, but we are running a bit short of time now. So I'll probably save that for another time. And if anyone wants to have a separate conversation, we can do that on another day, or please by all means do go to the website medway.gov.uk/healthy workplaces and read up a bit more on what we do. Just going to skip to the end. So there's our email address there if you want to get in touch, and if you haven't had a chance to fill in the feedback form, you can either scan the QR code or take down that link. Do give us your feedback from the seminar. It's always good to hear how you found it, and then we can help shape seminars for next time. And if there are any other topics you would like covered that you'd like to see us putting on, we'd be more than happy to do that. Just before we go, any further questions before we wrap up?
I would just like to say I would really love everybody's feedback on that, because I know we skimmed over so much information in such a short space of time. So if there's anything in that you feel like I'd like to know a little bit more of that, if you could let us know, because we could always do a little presentation on that subject, because it's such a wide area that there's so many places we could go with it. So yeah, your feedback would be great.
Well, that's great. Thank you so much for coming on this afternoon, everybody. If you have no further questions, feel free to go. Myself and the team will be hanging on the call for a bit longer. If you have any questions or want to ask anything, I'll stop the recording now, so feel free to ask anything that's maybe a bit more personal. And thank you so much for coming along, and a big thank you to Nicola for such an excellent and interesting presentation.
Thank you.